Fellow advocates, I am so excited to share some updates on how your advocacy and involvement is helping end preventable stillbirth in the US. First, HRSA has added stillbirth as an outcome measure in their maternal and child health block grant. This is what was quoted in the Federal Register notice. It is that HRSA will add a national outcome measure for stillbirth rate, defined as number of fetal deaths at 20 or more weeks gestation per 1,000 live births plus fetal deaths. Now, this is a huge win, but that still means that we need to pass the Maternal and Child Health Stillbirth Prevention Act, also known as SPA. And the really exciting news on that front is that SPA passed the Senate by unanimous consent. And what that means is that there wasn't a single person in the Senate who said anything against this bill, which gives it a really good chance in the House, but that still means that we need those advocacy efforts in the House of Representatives. And we are so thankful to every single one of you who have made those calls, who have done those one-click politics forms. It truly makes a difference. We are also incredibly thankful to every person who not only joined us in DC, but also just cheered us on while we were there. It meant so much to be able to look on social media and see people cheering us on, sharing their babies' names, sharing their stories, and then also making those calls and taking action from their home state. And that's what leads us to these two action items. Okay, so since SPA passed the Senate, that means that we still need the Shine for Autumn Act to have advocacy in the Senate. And so now we have two of those one-click politics forms. Those are the forms where you enter in some of your information and it sends the message directly to your members of Congress. So now we have two of those. We have one in the Senate, which is specifically for Shine, and then we have one for the House of Representatives, which is both for Shine and for SPA. And so what we need you to do is to continue to circulate these forms. We need you to continue to be signing and sending these forms, which will continue to urge your members of Congress to pass these bills. Both of these bills are incredibly important, and you can learn more about them down below. Finally, we are really making some ground in our health department outreach and in some very exciting ways. So first, we reached out to the Department of Tennessee, and we found out that Tennessee is actually doing a pretty great job. They're cleaning up their data collection protocols, and they're also working with a very strong FEMR, that's the Fetal and Infant Mortality Review team, to be able to analyze certain stillbirth cases and look at those on a community level, seeing what changes can be made at a county level to help prevent these deaths in the future, which is super exciting. So that's something that was really great to note. And also it was a great model to be able to look at to present to further health departments. We also met with the Minnesota Health Department, and that meeting was interesting. It really gave us a lot of insight into what these health departments are dealing with. You know, they get a certain subset of money and then they have to decide where that money is going to go. And if they're going to allocate that funding to someone else, that means they have to take it away from another person. The good news for this is that we were actually able to present them with a funding opportunity that could be used for stillbirth prevention practices. And so to be able to make that connection was huge. Additionally, we were able to share that HRSA had updated their outcome measures and had added stillbirth and stillbirth prevention to that language. And so that, I believe, made a huge impact as well. So we're going to continue building those relationships and continue investing in Minnesota with the hopes that they will begin investing in actual prevention and not just in bereavement. We just had a meeting with the California Health Department this morning, and this meeting was very encouraging. I've personally met with the California Health Department several times, and this was very exciting to see, to be able to present them with some solutions of some things that could possibly work and things that could be implemented in California. And then for them to take that information and say, okay, what can we actually do? And so one of the commitments they made to us is that they're going to look at their systems of data collection for stillbirth. And I know this sounds like such a small, minute change, but fixing systems of data collection is really the first step. because we can't begin to prevent something unless we have that body of evidence and that body of data, which is telling us what the true causes are. And so that's a really big deal. And we were able to share with them how a member of our team had a stillbirth in California, and she is really trying to change the cause of death on her son's birth certificate. And she has gotten nowhere because there's no system in place to make that happen. And so we're really encouraged by this meeting. And in our follow-up, we're going to continue to push for them to improve those systems of data collection, and then also see if they would consider investing some of that funding into that prevention project. There also may be opportunities for legislation in California as well. So if any of this sounds interesting to you, if any of this sounds like something that you want to get involved with, or maybe you want to be on a call with your own health department and see what your state is doing to prevent stillbirth, please shoot me an email. You can respond to this email, or you can email me at pushpregnancy.org. I would love to work with you on this to find out what your state is doing and see how we can help make change on the state level. None of this could happen without your help. As you all know, right now we are a team of volunteers, and we are doing everything we can as a volunteer team to make this happen. So if you don't have the time, or maybe you don't have the emotional energy, I mean, I was there. I did not have the emotional bandwidth to be able to do this work for a long time. And so if you aren't ready or aren't able to take the time and the energy to do this work, we would love for you to donate to our cause. And you'll find the link to do that at the bottom of this email. It would make a huge difference, and it just helps fund and fuel our efforts to end preventable stillbirth in the US. Thank you so, so much. I know sometimes it can feel like the efforts we're doing, making the calls, sending the emails, signing a letter, sometimes it can seem like so little with so daunting of a change that needs to happen. But it's truly every single one of us working together and raising our voices that is creating change. Just this morning, I found out about a congressman in California who signed on to both bills. And it was so encouraging, because that's all of our advocacy. And when we were in DC, we were actually able to talk about stillbirth, and there were much less people saying, "What is that?" I know that sounds like a really, really small win, but it is a big deal. Increasing awareness on this public health crisis is a very big deal, and that is because of each and every one of you. So thank you so very much. I can't wait to give you more updates of successes. I hope that you are able to celebrate some of these wins and know that it's because of you and your efforts that these are happening. So united, we push.